So welcome to the WorkBetter Lab. This is the very last days I mentioned of our Health and Wellness Weeks. A little bit about WorkBetter for those who haven't heard about it. We've had a temporary lease space in downtown for about 7 months. And we were able to arrange to flip the space from the return to the office commercial design ideology to the clinic of the future. And so just a little bit more about the space. This was an old, stodgy law firm. It's about 5,000 square feet. We had a very limited TI budget when we were changing it to return to work of about 50,000 and about 6 weeks to do it. So there's a lot of blood, sweat, and tears of the Seattle team, both from Porter, Steelcase, and OpenSquare, that was put into the space. A lot of DIY projects that you're going to see. We did very little TI work. The furniture in the space and the technology, about 60% plus is existing. So there's a really good reuse story to tell here. We have a lot of clients that made a lot of investments with assets before the pandemic. And as we're not really sure what the new normal is going to look like, it really tells a good story on how we can leverage those assets and then be able to refresh it and make it look new. So we intentionally called this the lab because it is a living, breathing experiment. Every day we come in and there's something that's been moved or changed based on feedback from our customers and partners. So if there's anything that you see that you'd like to give comments or make suggestions at the end, we definitely would welcome that. So back to the story of the space. Again, like I mentioned, it was a stodgy law firm. It's typical. We're standing right now what was in the executive boardroom. We've only torn down 3 walls. There were 2 that separated this off from the cafe and pantry area, which we'll show you here in a second. We were able to take those down to open the space up. And then there's another wall in between 2 of the private offices that we took down to open up and make a bigger space. But other than that, there was literally no construction that happened in the space. So you do have to put on your imagination caps a little bit. There are a few things that would not be normally clinically environmentally appropriate, but we really couldn't replace flooring in the exam room. So you're going to see carpet. And there is a significant amount of live biophilia in the space that I like to tell people maybe a little bit pushing the envelope too far for our healthcare clients. But I think it does still tell a really good story about how important biophilia is. So we'll get started. So we're standing in what we're calling our welcome transition space. You know, one of the bright spots from the pandemic for me is that healthcare figured out how to deliver just-in-time service. There's very little waiting in a waiting room any longer. So the need to densify our waiting rooms and do the rows of bus station seating seems to be over, thank goodness. And when you come into the clinic, typically you're taken back to the exam room right away. So the space that you're going to see here in a second, we've really set it up to be more of a hospitality-like space and bringing that feeling of home inside. One of the other exciting things that I've noticed is that the whole bringing hospitality into healthcare has really been accelerated because of the pandemic. And then again, what are the things that we got used to at home over the last 18 months that we could put back into the spaces that we're trying to create as destinations so that people want to come to them. People are putting off elective care and things like that because they just really don't want to go into a sterile clinical environment anymore. So what you're going to see in just a second as Matt moves the camera around is what we're calling kind of our transition living room space. So this is our living room space. It is set to be and look just like a living room. Everything that we're showing here is a healthcare appropriate piece of furniture. Since you are interested probably in what those are specifically, I will tell a few product names. Really won't mention a lot about product on the tour, but we are showing some pieces here from one of our aging living partners, Pollard. And then this is actually a healthcare love seat from Sonnet. Everything else that you're going to see in the space is kind of a blend of open lines, Steelcase partner brands, and Steelcase. Again, at any time, if you want to know what something is, we could follow up with you after the tour with the leave behind. We've set this up intentionally to create pods so that depending on what your family unit or you want to do as an individual as you're waiting to see your physician, you have a variety of different modes and postures that you can work in. So you can sit here in the casual living room. or you can come back here to what we're calling more of our cafe area. And you can do some work if you were waiting on a family member to be seen, or maybe you want to stand and be a little bit further away from the rest of the crowd. You can do that here at the standing high table, as well as enjoy a great beverage and a snack. So we'll continue to move throughout the space here. One of the other things that we thought was really important was to make sure that we engage our technology division to showcase some of the things that our great technology team can do. Another big thing that we're seeing in healthcare is making sure that people know exactly where they need to go so that they're not traipsing through the clinic in places that maybe they don't need to help limit exposure. So here we have an interactive touch display, and let's say that you're coming in to go to the community space because you're here for a support group and you really don't need to go to any part of the clinic. You can actually scroll through here, find community space, click on the community space icon, and it will show you with the red dot exactly how to get there. It will tell you a little bit about the space as well. So we've actually set the entire clinic up so that you can click. It will show you how to get there, and it will tell you what that space has been designed for. So the consultation room is set up for two purposes. Number one, it can act as a care team meeting space, but then it can also be a consultation space if a physician or caregiver needs to meet with a family or patient. We have dual technology in this room, which typically we wouldn't do, but we're doing it to show a point. You've got a round table here that typically would be set up for 6 to 8 people. We're intentionally showing 4 chairs without casters to encourage social distancing until people are more comfortable to be closer together. The casters keep the chairs in place and allow people keep people from rolling into somebody's personal bubble. The other thing that you might have noticed that looks familiar is our Katai 360 camera. So that is located here in the center of the table so that everyone that is at the table could have that equitable experience with the participants on the other end. Now, if we only had the Katai camera in the room and we had this screen on the wall, you will notice there's a bunch of windows behind me. There's a really beautiful view to Pike Place, the Great Wheel, and the sound. In a normal conference room with the technology there, for the most part, we have to have the blinds down because of the glare. So this is where we really share with our clients the story about this mobile technology. This is a Microsoft Surface Hub 2 with a steel case roam cart. It does have a battery pack at the bottom. So if I wanted to, I can unplug it and it will continue to stay charged for 3 hours, and I can move this technology anywhere that I need to move it. The cool thing about that is, for instance, if I wanted to have a Zoom call, I could pull it over this direction, and then I can use the gallery wall that we have right there as my Zoom background. The other great thing about this is that if, for instance, someone else needed this room and maybe I needed the technology, instead of the room owning the technology, I can take the technology out and take it to where I need. It reminds me of back when I was in middle school and high school, and the teacher would go and get the TV or the projector card for the day. We wouldn't have really probably had access to those things in my school if we weren't able to share them across multiple classrooms, because technology is just really expensive. So the theory here is, instead of a room owning that technology, maybe the team can own it and it can move about the space. Yeah, so we'll move on into our physician office. Here in Washington, I feel like we were this close to prying the office out of physicians' hands. And then the pandemic happened, virtual care happened, and now they have a lot of justification for needing that personal space to be able to do virtual care visits. So if they have to keep the private office, that real estate's really expensive. How can we help the healthcare organizations that already have stretched budgets leverage that space more efficiently and effectively? Well, one of the thoughts that we had is maybe you add a second desk to the office and they are able to bring the PA or the MA into the space with them so that they share the office. And you leveraging the room reservation system, if you had team care that had off-shifting schedules, maybe they could just reserve this office and the two could use it for the time that they needed it. what we're showing here are a couple things. You do have a height adjustable option as well as a standard height option. Again, really bringing that home office feel into the clinical space. Our physicians got to work from home as well for the last 18 months. And so bringing some of the things that they got used to back then, we're hoping is going to help with burnout. And speaking of burnout, what we've been hearing from a lot of our healthcare organizations here is that it'd be really nice if they could have a place to kind of take a break and maybe take that power nap. I know one of my favorite things that I got used to from working from home was being in close proximity to my bed. So if I had a really long day into a long night working on a project, I could just pop in and take a 20-minute nap at my lunchtime. Well, imagine you're a patient or you're a physician and you've been seeing patients all day. Maybe something really traumatic happened with one of your patients. If you could lay down, take that quick power nap, and then get back up, maybe that would help with the workforce shortages that we're seeing. Full disclosure, I had food poisoning 2 days ago, and because Matt was in Spokane and we had a limited number of days to do tours, I was still here, nauseous, and taking naps on the sofa, this very one, in between all of my different virtual tours. And I was able to actually make it throughout the day, even spending maybe 4 or 5 visits in the restroom being super nauseous. So it really does make a world of difference. And I'm now a big fan of the surround sleeper sofa. It is extremely comfortable. I was able to fall asleep even with a bunch of chaos going on out in the lab area. One of the other cool things that we're showing here is Brain Point by West Elm. So here we're talking a lot about how, we bring the home aesthetic of West Elm with the durability and the reliability of Steelcase together to create the best of both worlds. Here you can have a physician working while you had a PA or an MA working. Both of them could actually do virtual visits while in this room due to the visual barrier that we've got placed here, the extremist sticks. And so, Matt, do you want to talk a little bit about why these are important versus virtual backgrounds?
Yeah, do you want to start that V10 monitor? Yeah, so there's actually been a lot of research that have come out that has shown that when we're using these blurred backgrounds or digital backgrounds, we're actually causing a lot of anxiety for the other people on the other end of the call. We're not really thinking about that equitable experience. Now they're wondering who's in the room with you, what's happening, what's behind you. So what we've done here in a number of places, we provided these type of Zoom backgrounds in the lab. So here we're using the extremist sticks. You can see Rhonda's now back there at our physician's desk. She's doing some charting and some work back there. You can see movement and see change, but you're not necessarily distracted by a blurred background. You understand that there's a screening mechanism that's helping kind of hide her, adding a little bit of privacy, but thinking about that equitable experience. And as we move through the lab, oftentimes with clients, we'll talk to them about creating those Zoom backgrounds in different ways throughout the lab, even some ways in the open plan.
Or CheckIn. So one of the things that, again, trying to help with the workforce shortage, employee retention and attraction, unfortunately, our CheckIn professionals typically get stuck behind oh my goodness, I'm so sorry, behind what I like to call the CheckIn fortress. And it's really not a very fun work experience for them. They have to sit behind a desk. Also for the patient coming in, it's not a very inviting experience to come in and there's this giant monstrosity between you and the other human. The other cool thing that I like to say that the pandemic did for us is instead of coming into the doctor and get handed a clipboard with a bunch of paperwork that you need to fill out, most of that insurance verification, health screening, health history, all of those things are done before you get into the clinic. So when you arrive, it's really just verifying that, yep, that's Matt. He's here for his visit. Now I can take him directly back to the exam room so he can be seen by his caregiver. So with that, that allows for us to change the check-in space to more of this mobile table desk experience so that the check-in personnel can get up and move around. The other thing that you're seeing in the space is a giant 138-inch LED screen with over 1 million pixels. We are showing a little bit of digital biophilia as well, because if you can't have the real thing, this is the next best thing. And this particular video is set to calm your nerves and anxiety. So if you're coming in for a really, stressful visit, or you're just nervous about being in the clinic for the first time since the pandemic, this will help calm you down naturally before you go for your visit. Our telehealth pod. And I know it has clear glass. Again, beggars can't be choosers. We were really excited. This is the first orange box on the QT that's actually left the factory and came to any location. So we took clear glass. If it were a true virtual care pod, that would obviously be some sort of like privacy glass or frosted glass for privacy concerns. It is located right in the entrance of the clinic intentionally. There are a couple reasons for that. Number one, I was very sad to learn that in Washington State, we are ranked 48 in the country for access to quality care, which is a really sad statistic. That literally means we're the worst in the continental United States for being able to get the care to the Washingtonians that need it. Part of the reason for that is that the new social determinant of health is actually the digital divide. Not everyone has access to high-speed internet or technology that allows them to do a virtual care visit. So if you put something like this in your community clinic near a concierge, if I do not have access to those things at home, I could still make my way into the clinic. I could get onto my virtual care visit. If I was uncomfortable with leveraging that technology, I could have the concierge help me because they're in close proximity to be able to do so. One of the other exciting things that we're doing here in Washington is we're working with a lot of our tribal organizations, the health partners there, to find ways to put these in community centers, homeless shelters, and even large retail spaces like Walmarts. There's a Walmart and a Dairy Queen in almost every little rural town that I've ever been through. And I said, my next mission is I'm going to figure out how to get these into Dairy Queens and how to change the menu to maybe add some healthier options. So this went over really well during our shows because it's really very soundproof. It has its own ventilation system. You can even get these with the blue light to do the sanitization. This one is not ADA compliant. We've had some people talk about that, but the Orange Box, they do have options that are, and they have larger pods too if you needed to do virtual care visits for family, for instance. So we're going to head through to the mobile team care area. Again, this is where you're going to have to use a little bit of your imagination. We were really fortunate to have the AMQ Amobi product here for the first part. And for those of you who haven't seen that, the screen options and things like that are more appropriate for a clinical environment. We are showing upholstery here everywhere, which normally you would not do in a care team area. But again, beggars can't be choosers. So we ended up with this particular type. You all know the Flex product from Steelcase. I'm not going to go into great detail about that. But one of the number one complaints or challenges that we've been given by our healthcare teams and clients here in Washington is how do we make sure that our nursing staff can move around throughout the day so that, again, they're not stuck behind a large nurses station and very stagnant and not able to move and change as their duties do or as their modes of work throughout the day. So one way that we've been able to accommodate that is by providing them with these self-contained desks. So as you know, everything comes all in this one desk. You've got your electricity. You're able to move this the way that you need to throughout the day. The way that we're able to achieve that, of course, is by running our modular power solution underneath of the carpet. We do usually raise up the carpet tile here and show our tour attendees how this works. I'm going to skip over that part since you guys know all about thread. But as you know, being able to put in this modular power allows us to be able to move and change these units throughout the day as needed. Is there anything else?
No, I don't think so.
Okay.
They know Flex.
We are also debuting the Microsoft Surface Hub, a really large one. For a healthcare organization, this would really allow the care team area to be very collaborative, to be able to do, again, some sort of virtual care or virtual visit with other physicians, to be able to do a collaboration on a patient. We were really excited to be able to get this into the space. We partnered with on the space as well. This was one of my favorite parts of the lab. This is showcasing 4 of our design firms that we're doing sub-consulting with on pre-design and schematic design in healthcare. So we have ZGF, MBBJ, Perkins and Will, and TGB. I think you guys work with at least 3 out of 4 of those. And what these banners are showcasing are their latest and greatest research around healthcare spaces. And so we're happy to send you more information about that. But they were able to come last Tuesday to the cocktail party that we had prior to the Biz Now event, and they were really excited to be included in this display. So we're going to move now on over to the community space. And almost every clinical project that we're working on here in Washington now, we're being asked to put community spaces into the floor plan. The reason why is because people are really trying to draw people into the clinic before they get sick or to prevent them from keeping sick. They really want it to be a community hub, a place where community members come to be together. And so here in this space, we're showcasing how could you leverage it in a variety of ways. Well, maybe some of the things are you've got a distress with art class, a watercolor class that helps relieve anxiety and stress. Maybe you're going to do CPR training here. If you are, fortunately, we've got these really flexible tables and chairs, very lightweight stacking chairs. And then obviously you're familiar with the verb table. You're able to nest these, stack them like grocery carts, get them up and out of the way. So again, this can go from our seat check class to a yoga class in just a matter of minutes. One of the other things that people are still doing are making children. So because of that, we need to make sure we make spaces for children. If you're coming in for a Parenting 101 class, you may not have the resources to get a babysitter. Maybe you need to bring the children with you. And so here you're able to bring your children, have a space for them to be entertained, still be part of the class, and be able to participate in those resources in the clinic. We talk a little bit about flex mobile power here too and how that works. We'll skip over that since you're familiar with it. Again, we've got mobile technology in the space. So if you needed to have a virtual segment of the class participating with the physical segment, you could break those experiences very easily with the Surface Up. This is Flex Frame. If you guys haven't seen it, again, we typically don't talk about product, but I know this is brand new, hot off the presses. It came in for a Microsoft mock-up, and we were just fortunate enough to be able to get it. So now we're going to head down to our behavioral health counseling office. So before the pandemic, I think the statistics were that 1 in 5 people faced a mental health condition. Now they're saying that's going to double, maybe even triple as we're coming out of the pandemic. One of the other things that I know keeps people from going in to see their counselor is access to that care. Actually, in the state of Washington, outside of King County, there are only 3 licensed psychiatrists. So for instance, if you lived in Port Angeles, about 3 hours away, you have a 6-hour round trip commute to come in for a behavioral health visit. So one of the ways, again, I believe to get care out to where it's needed is by having virtual care options. So in this space, we are showcasing the Boardwalk product. It's very low to the ground, which is intentionally designed to create kind of a calming sense. So here's where a traditional counseling visit could be conducted. And then we're also showing it with this conferencing table solution for free. So if you were in your counseling visit and your counselor needed to educate you on something, you very easily can move over here. You also can move the screen so that the family could stay in place. The counselor could also use this as their office because it's a very effective setup for that. And then if this were located inside of the primary care clinic, this could also double as a second respite space or a second team meeting space. Now here's where you really have to use your imagination. This is the exam room. It is a little bit larger than a typical exam room, just barely. And again, it does have carpet. We've also got a clear glass window and some sheer curtains, which normally you wouldn't have. But what we're showcasing here is really what we're calling the exam room of the future. So we've got your modular casework here. This is conveyed by Steelcase, and we tell the story about we're seeing a lot of our healthcare organizations in Washington start to think about doing shorter term leases, 3 or 5 years. They're doing that because they're not really sure that they're putting them in the right areas of need. And so they'll go in and build very expensive millwork, and then they have to leave it with the building. So we're telling the story. If you're going to do a short-term lease, maybe you do, you spend the money up front to do something that you can take with you. Also, depending on where the money's coming from a budget, as you know, this goes into the FF&E budget. You can depreciate it over 7 years. It also, right now, with the workforce shortages in construction, speeds up the time to be able to open the clinic, as long as our Steelcase partners can ship it when we need it. Some of the other things that we're showcasing in here are the family zone. That's not new to the exam room. Unfortunately, it went away briefly while we were going through the pandemic. You really couldn't bring your family with you. So when you can't bring your family with you to set on this beautiful piece of regard, you can, again, call them in for a virtual care call. Here, I like to tell the story. I'm from Kentucky. All my family's in Kentucky. I live in Washington State by myself. If I were to have a healthcare crisis, it would take my mother 2 days to get out here by plane, just because that's the way that it works. So if my physician could call my mom in and she could be part of my care visit, listen to the things that are happening so she could help me with my follow-up care, that would be incredible. One of the other things that we're seeing is team-based care. CHI Franciscan, Swedish are both, they've opened command centers here in the state of Washington. So what that means is, let's say that Matt and I are in and I'm for my primary care visit, and we find out that I need to see an endocrinologist. My primary care physician can call back to the command center while I'm in the room, bring an endocrinologist into the examination, and instead of having to be referred, going to a second appointment, waiting months potentially to get in, I can get the care that I need at the time that I need it and accelerate my recovery time. So we're really excited that healthcare organizations are starting to adopt that and leverage the technology we've had for a long time to be able to bring the team care to a whole nother level. One of the other things that you're seeing in the space is an exam recliner. So this is the transformer. It goes from recliner to exam table with a push of a few buttons. Again, I'm preaching to the choir a little bit here, but as you know, most healthcare visits, you go in, you have to sit on that elevated table with your feet dangling on the crinkly paper, and more likely than not, the physician is never going to touch you. You're at an awkward eye level. It's a really awkward experience, all for naught. So again, we're starting to see people like Kaiser, Seattle Cancer Care Alliance, opt in for using the recliner, and then they're able to just raise and change it if they do need to do an examination in that rare case. Another thing that we have been seeing is that a lot of healthcare organizations were putting recliners and exam tables in, which was causing the exam room to be much larger than it really needed to be. This alleviates that problem. And last, but certainly not least, you probably couldn't help but notice BOTC is in the middle of the exam room here. We were really fortunate that BOTC was able to come up and visit us, not only for Health and Wellness Weeks, but for the Biz Now event. BOTC got a ton of attention. We took them down to the Fairmont Hotel for the event. As you know, UV cleaning sanitation robot. BOTC is mapped, so at nighttime, runs their program and sanitizes the space. For those who don't know, BOTC also has a friend that can move carts throughout the hospital. So one of the #1 workplace injuries in hospitals where employees were getting injured moving carts, really heavy carts from place to place in the hospital. BOTC has a solution for that. EVS services also are very scarce here in Washington State. Healthcare organizations are having a really hard time finding personnel to do EVS. And so when you can't find people, the next best thing is a robot. When something's unsafe, like moving the carts, maybe you get a robot to do that, and then you leverage the people to work to the top of their license and do something more important. As sensory and occupational therapy as alternative forms of care are on the rise, and more people with neurodivergencies are coming into corporate spaces to work. I tell the story here that, our friends over at Microsoft, they're really ahead of the game on their diversity, equity, inclusion, and they're hiring a ton of people on the spectrum. So we're working with, as a health and wellness team, with our corporate commercial teams here on how do you bring those spaces into the corporate environment, but also into the clinical environment. During the Biz Now party, and Kristen was one of the people I caught in here on a regular basis, we had 70 people in the space in 5,000 square feet over 3 hours. Most people had not been to a cocktail party since before times. And every time I would walk back here, even though we had great food and great drinks out front, somebody was inside of the work tent with their eyes closed or playing with the remote control, changing the color of the light with the weighted blanket on, relaxing. This particular chair is a behavioral health piece. It comes from Pineapple. It's a little awkward looking, but the design is very intentional. When you sit in it, it creates a chemical release in your brain that automatically lowers your anxiety and calms you. We're really reaching all of the senses in this room. I'm not sure if you can hear the crickets. I'll be quiet for a second. If you were here, you would also be able to smell the diffuser. You would also be able to touch some of these stress relieving toys that we've got, or sensory toys that we've got throughout the space. And one of the things that I like to say is, the only sense that we weren't really reaching was taste until we added this rice table. And now if you wanted to eat this, you most definitely could. So you've seen sand gardens and you've seen soap cutting and things like this. Same kind of thing. It's a very tactile, kind of relaxing experience. And then we're also showcasing some really soft other sensory toys that just help you kind of clear your mind. So one of the number one challenges right now in healthcare, again, no newsflash to you, is workforce burnout. Being able to get away when you need to, when you're having a moment, is a human need. It's not a luxury. And so in this last 2 weeks, and at the event last week, we've really been educating our healthcare organizations that we have to build these spaces into our designs. They're no longer just nice to haves. These are absolute must haves. They might even be the most important spaces that you're putting in for your care teams. So here we're showing, again, we couldn't do a lot of construction. We've actually are using answer panels to divide space here. And we're creating 2 individual respite spaces. And I'll let Matt kind of take you back there and show you what we've got going on.
Yeah, so in this nook, we have our Lagunitas with a laptop table. We have a lot of conversations with our customers and tours that, policy and company culture get really important in this type of space. So this would be a no technology, no phone, no laptop space. So that table would be more for like a mother to be able to do what she needs to do, or maybe to hold your book while you're doing some relaxation. And then I'll have Rhonda show us these AMQ sliding screens to help provide some privacy, a little bit of biophilia. Love that backlit aesthetic, which is just beautiful. And then on this side, we have our Steelcase surround. It's a really nice nook. When the lab is not being done with tours, you will find people back here just kind of quietly doing their email and really just kind of relaxing and diving into some really nice focus work, which is nice.
So this is a dual purpose space as well. This is our group respite space. So I talked a lot about retention, burnout, in, again, healthcare. A normal year in 2019, statistically, about 18% turnover was normal with people leaving healthcare. In 2020, it was over 34%. And so that is a really scary statistic. A lot of our frontline workers faced a tremendous amount of trauma that I would never be able to understand and took sabbaticals. We're hoping that they come back as the boomers are getting ready to enter our healthcare system and overwhelm it with those level turnover rates and the lack of people entering the healthcare world. We potentially could be in really big trouble in the United States if we don't figure out a way to help our caregivers relieve stress, not burn out, and stay in the healthcare field, and then attract people to enter. So how do you do that? I think it's like talking to the CFO. As I mentioned, they used to think about these respite space and break spaces as luxuries. These are necessities. You have to have them. This is a very big footprint. So how do you leverage this with the CFO and talk about return on investment? So during non-team meeting times, this could be a group respite area. So for instance, if Matt and I were both caregivers, I just saw something really traumatic. I knew Matt was back here. I could come back and talk to Matt because I know he's going to understand. We could also have a chair masseuse come in. We could have meditation classes here. There are really great tips on the whiteboard about coping with traumatic stress and preventing burnout. This room has also been set up, even though it feels and looks very calming and a lot like home and very relaxing. It can be an effective large team meeting space as well. So getting back to the ROI for the CFO, they're going to put in a large team all hands room on the floor, usually no matter what, or in the clinic. So how do you just leverage that for dual purposes and talk about it in a way to use it multiple times? I also like to tell people on the tour, normally you don't get to pick when you have a moment, you can't schedule those. So it's really important to make sure that you have the individual respite spaces as well as the space in case there is a large meeting going on in this room and somebody needs to access the respite space. So together they're super important. Matt, do you want to talk about any of the design intent around why this room was the way it was?
Yeah, so this room, actually, a lot of it carried over from the original iteration of the lab because of the popularity of the space. One conversation we would often have is in these old school design plans, we used to always do a large board conference table in a space like this. And typically what happens is it just kills collaboration from the rest of the team, because if Rhonda was a junior nurse or a junior summer intern at some corporate facility, and she was sitting at the back of that large boardroom table, which is typically where she would end up, all those senior folks sit at the front. She's very unlikely to say, excuse me, 7 times to get past all those senior folks to get up to the technology of the whiteboard up front. But this way, breaking up that table into 2 personal Lagunitas tables and having this kind of similar or same level sitting back here, no matter if she's a summer intern or she's the head doctor, they are all equal now, shoulder to shoulder, and makes it collaboration. I mean, collaboration from back there jumps a ton when we open up the space and leave about even 5 feet of space up here at the front of any space to allow people that ability to get to the whiteboards of technology without having to say, excuse me, 7 times. Then you'll also notice that all of the other furniture in here, whether it's the poof or the coffee table, are at the same seated height as the circle lounge here. So Rhonda would actually be able to interact with someone across the Lagunitas table at that same eye level. Just really, again, makes the space as usable and as versatile as possible. And then I'll have Rhonda move over here because I think we're done. This is also one of our most popular backgrounds to do Zoom calls in front of. People just absolutely love it with all that biophilia and greenery. It just really helps soften any call that someone jumps on. And then that beautiful Moy lamp doesn't hurt either. But yeah, that is the lab, almost right on time. Good job, Rhonda.
Thank you. Thanks, Matt.